So it's a little bit like the gut is now our second brain. 90% of the happiness hormone called serotonin that keeps you smiling is actually made by your gut microbes. 70% of your immune system also lies in your gut. In 2013, there's a reinvention of the view. There's a revolution. By using fecal transplant, we can now treat a very serious, life-threatening conditions.
Hi everyone, welcome to CUHK Podcast. I'm Moses, a final year medical student and your host for this episode. Today we're exploring the fascinating world of gut microbiome and its incredible impact on health, inflammatory bowel disease, and autism spectrum disorder. We are very privileged to have Professor Siew Ng from Faculty of Medicine at CUHK to join us today. Professor Ng, thanks for joining.
Hi Moses, good to see you.
Now, before we begin, don't forget to subscribe to our YouTube channel and follow us on social media for our latest updates. Now, let's jump right in. Let's start with some basics. Professor Ng, can you please introduce to us what exactly is gut microbiome and why is it that important to our health?
Thank you for inviting me to talk about a topic very close to my heart. So the gut microbiome is like a microscopic world inside the larger world of your body. So it's like all these tiny little microorganisms, collectively, they can help you control many bodily functions. So for example, they can control your immune system. They help you to digest food. They can now even control your mood and your sleep and maybe how well you age. So we know that if we can harness the power, we can probably improve human health better. So it's a little bit like the gut is now our second brain. So many would know Hippocrates says all diseases begin in the gut. And I personally believe this is very true. Now, the thing is, people always think, is your gut microbiome the same as mine? So I think, Moses, your gut microbiome and mine will be very different because our microbiome are very unique to each person. And it depends on how you were born, the places you travel to, the food you like to eat, or whether you had pets when you were young, or your experience in early life. So it's like your little fingerprint. And I think it's very unique and it helps you protect from different types of diseases. And I think one of the very important points is why do we care to understand the microbiome? The fact is that we now know 99% of our DNA belongs to our microbes, and which means only 1% belongs to your own body. So the 1% that you got from your mother or your father, I think those are the ones you can't really change. But that remaining 99% of the DNA in your microbes, you can actually change it to improve different types of diseases. So you are essentially just 1% human when you walk around like a superorganism.
So you have mentioned how important our gut microbiome is. So I'm wondering, what will happen if our gut microbiome goes wrong? Is there any specific diseases that may link to gut microbiome imbalance?
I think that's bad news. If you have this imbalance of the gut microbiome, we now know that it is now connected to many different types of diseases, ranging from life-threatening conditions like cancer to obesity. People start gaining weight when they have a different set of microbiome, to even diseases of the skin like eczema. And for our group, we've been working on an inflammatory bowel disorder, and of course, children's disorder like autism spectrum disorder. And even recently, there have been a lot of work looking at microbiome alterations in Parkinson's disease, in mental health illness, and even in dementia. So I think the impact is going to be really huge if we can do something to change our microbes.
You have mentioned about inflammatory bowel disease, in short IBD. So can you tell us more about its relationship with gut microbiome? And do other environmental factors like diet and lifestyle may influence it?
So inflammatory bowel disease, IBD, you can divide it in Crohn's disease or ulcer colitis. Now, maybe 30 years ago in Hong Kong, nobody cares about it. I think if you're a medical student 30 years ago, you probably don't have to learn about IBD because it doesn't exist in our society. But I think something happened in the last, decade that changed suddenly an increase of IBD in this population. We are now seeing young men, young women in their 20s who come in with diarrhea, rectal bleeding, inflammation in the gut, and they end up having inflammatory bowel disease. So we call a Western disease now creeping into our Asian society. Many people ask why, right? Some has argued maybe it's genetics, but I would say our genes will not change in only a decade or even 100 years. So it's got to be something in the environment. So we've been working on looking at what has changed in Hong Kong. If you think about it, Moses, what do you think is one of the biggest change in Asia? Well, I would say one common thing that we all love, the food we eat. Everybody loves food. We eat to live. Some people, live to eat. But we now know that diet, especially westernization of diet, for example, high fat, high sugar diet, basically diet low in fiber, low in vegetables and fruits, can lead to inflammation in the gut. But it's even more complicated now. It's not just about the type of food you eat, but it may be what's being added to the food. If you think about in the busy life of Hong Kong or Asia, what do most people do? They have processed food, ultra processed food that is very convenient. And a lot of food additives are added to that. So we now see an explosion of inflammatory conditions, immune-mediated conditions, and I think in part actually it relates to changing diet patterns in the Western and now creeping into the East as well.
While IBD is a well-known condition, your research also explored a surprising link between gut microbiome and autism spectrum disorder, ASD. So I'm quite curious, how did you come up with the idea that a gut microbiome problem can contribute to a brain development issue? How did you start this topic?
So I think when I first tell people or other, researchers around the world first come out and say, oh, autism spectrum disorder is also linked to the gut microbiome. Most people, they just don't believe it. They say this is a brain condition, it's the neurodevelopmental condition. How could it be linked to the gut? But we now know there's something called the gut and the brain axis. So essentially, the gut talks to the brain every day. As we are speaking now, I'm sure your gut is probably communicating to your brain and vice versa. We just don't know that. So in autism disorders, we're beginning to notice that the gut microbes of these children who have this disorder actually are quite altered and disturbed. They have certain increase in specific bacteria, and this bacteria can release certain chemicals that go through the bloodstream and then go to the brain, so causing them to have certain repetitive behavior, social inhibition, and even language sort of problem. We actually did a very fascinating study. We basically take like the microbes, the stool samples of children with autism, and we gavage, put them into germ-free mice because we want to prove that these microbes play an important role and convince people that it does affect the brain. And guess what happened? These mice start manifesting autism-like behavior. They actually stop mixing with other mice, and they also become very inhibited, and they have repetitive actions that just go round and round. They will basically bury all the marbles repeatedly 100 times or so. So I think it gives us a lot of insight that actually if we look at the gut microbes of autism children, we may have some potential to actually think about prevention, diagnosis, or even treatment.
Your recent groundbreaking discovery involves using a stool test for early ASD detection. Can you tell us more about it and what advantages it offers over conventional diagnostic methods?
So we're very excited about this, discovery. I think it essentially means, for example, one day you can collect a stool sample from a potentially suspected child who may have autism spectrum disorder. We then use artificial intelligence, sequencing of the stool sample. We are able to detect certain microbiome signatures. So for example, they have certain bacteria that are bad. So if they have, 10 of those that's increased, and then maybe 5 of those that's good that is decreased, we can come out with a risk score that can help us actually predict or even detect autism. And the accuracy is high, it's almost close to 90%. I think the beauty of this is right now, there's really no biomarker, no medical test to help diagnose autism. And the unmet need is if a child may have autism, they normally have to wait about 18 months to really see a doctor. So a psychiatrist, a psychologist, or behavioral therapist to make a clinical diagnosis by asking a lot of questions. So we think this will serve basically this unmet need by, for example, it's non-invasive. They can collect it at home, send it to the laboratory, and then get the test results within maybe a couple of days. Then the parents may be able to, depend on what the results show, seek, I think, treatment much earlier on. So we believe it will actually streamline this integrated care for children with neurodevelopmental disorder.
It's definitely a good news for a lot of families and parents. So, besides using gut microbiome as a diagnostic tool, I also heard that your group has come up with an interesting technology by using feces as treatment for certain diseases at high success rate. So, it sounds miraculous. Can you tell us more about it?
Yes, so this is called fecal transplant. When people heard about fecal transplant, they thought, oh, there's a yuck factor, is it? And some people, does it smell? Well, on the serious note, actually, fecal transplant, meaning taking like the stool sample from a healthy individual, we extract the microbes, and then we transplant, means we transfer it into someone with disease, usually through an endoscope or sometimes through a sort of pill. Actually, this has been around for a long time. The notion of using feces to treat disease. Actually, in ancient China, I don't know if in the Qing, in the dynasty time, there's something where they call golden, soup. Actually, it's actually that is fecal soup. People just have to drink it, and it's used to treat food poisoning. Because in those days, there's just no antibiotics. And during Second World War, camel stool were actually used to treat soldiers with dysentery. So now, in 2013, there's a reinvention of the view. There's a revolution. By using fecal transplant, we can now treat a very serious, life-threatening conditions. It's called Clostridium difficile infection, cause people to have diarrhea and blood in the stool. So we've been working on this for about 10 years, try to identify the good bugs and optimizing the technology. So about maybe 5 years ago, we're now being able at the Microbiota Innovation Center at Magic. It's part of the CUHK initiative. We now optimize the technology, and we're very excited to be providing this now to like 40 hospitals across the hospital authority in Hong Kong. So it looks like a CUHK innovation can actually hopefully benefit the society. And I think the future is quite exciting. I think it won't be just using endoscope. It maybe will be putting it into a pill or maybe getting certain microbes and make it into drugs. Then we will be able to maybe one day cure obesity, eczema, or even autism.
That's incredible. So, we now know that it's very important to maintain a good microbiome in our gut. So, is there anything we can do so as to live a healthier life?
Well, there are lots of things you can do. I'm thinking maybe I'll give like maybe a few tips actually. Actually, you are what you eat. And I think that is so true. Essentially, you have to feed your microbes the right food to keep them happy. So, what's the right food? Well, our microbes actually like a diverse type of diet. So, a plant-based diet, a diet rich in fiber, a diet low in fat, sugary stuff, actually it will keep the microbes very happy, and then they will keep you healthy. But not only that, the second tip is a rainbow kind of diet. If you just imagine different types of colors in the fruits and vegetables that you eat. And there's a saying that maybe you need to have 20 to 30 types of vegetables and fruits actually each serving over a week to actually keep the microbes rich and happy. So that's what we call rainbow, different types of color. There are other things one can do. You can increase prebiotics. So prebiotics are, for example, the food to feed the microbes. So these are food contained in bananas, in asparagus, in onions, in garlic, because they boost the ground for the bacteria to grow even better. Of course, others have been looking into using probiotics. So, probiotics are live bacteria that you can use to supplement your body when you have certain conditions. But I think I will always say, just a word of caution, it's very important to look at the scientific development behind these probiotics, to look at, for example, whether they have special technology like microencapsulation to let the bacteria colonize the gut, because our stomach is acidic. So if you take certain bacteria, it may die once it passes through the stomach and not very much, left, in there. So I think overall, other things that one can do is try to avoid like antibiotics because that may actually damage your microbiome. And the last piece of advice is have a pet. Actually, there have been studies showing having dogs or having pets actually increase the richness of your microbiome, and children have a lower risk of eczema or even allergies in due course.
So talking about probiotics, we can see a lot of options in the market. So as customers, how can we choose between them?
So I think you're not alone. That's a great question, always get asked. I think the first message is that not all probiotics are created equally. And the myth is that more means better. Actually, in contrary, more does not always mean better. I think the most important is whether you have the right combination that can actually reach your gut to give you the function that you want. So, for example, our group at CUHK, when we've been developing certain microbiome preparation, we do a few things. First of all, we use artificial intelligence and big data to look through to see what's really missing in certain conditions, like someone with COVID or low immune system, or for example, someone with a mental health sort of disorder. And then we are able to get the right combination that work the best together in the right ratio. I think the second part is the technology that is used to deliver the probiotics. For example, our stomach is very acidic. So if you take a probiotic, a live bacteria, by the time it reaches your stomach and your gut, 90% might have been killed by the acid. Then I think a lot of it has to depend on where it's being made, because we know the Asian gut is very different from the Western gut because of our diet, because of our lifestyle. So our gut microbiome may be very different to Westerners. So we always look at Asian data and then develop certain microbiome and then conduct clinical trials to show that actually there's efficacy. So during our COVID pandemic, we did a randomized control trial, and half the people got the microbiome formula, half got a placebo, and we found actually majority can have improvement in long COVID type symptoms like GI upset, brain fog, poor memory, or difficulty in concentration. So we are quite reassured and convinced that actually these microbiome modulation actually can have the efficacy that we anticipate.
As a clinician scientist working in the field of microbiome for many years,
Yeah.
so what do you see about the future of gut microbiome? Or do you have a big project waiting ahead?
Oh, this is exciting. I think if you ask me what is next that I'd like to do, I always think that the microbiome has a lot of potential and a lot of it has been derived from stool. Um, but if I were to have a project, I'd like to build a microbiome Noah's Ark. So you might have heard of, for example, the cord blood bank, whereby people store cord blood with the hope to treat genetic diseases in their children one day. There's also other types of, blood transfusion bank. But if you can store a stool bank, I call it a microbiome Noah's Ark, when the child is born, not exposed to all these contaminants, bad diet, different type of antibiotics or pollution, we can store the microbes that's still healthy. In fact, a lot of studies have shown that our ancient ancestors' microbe has now disappeared as we go into the modern world. We have a lot of missing microbes that no longer exist, and I think we need to preserve them. So in this Noah's Ark, we preserve the microbes that are uncontaminated, and then one day, maybe the person or individual may develop a certain disease, allergy, eczema, or even autism spectrum disorder. And there may be a potential and a hope to be able to extract those healthy microbes and transfer it to the person to actually benefit their own health. The second part is, I think we are in the era of artificial intelligence and we really can't escape from it. And we are now using artificial intelligence to work with microbes, which means things we used to need to work for days, for example, weeks, now within hours, we can get the big data set. We need to really bring, I think, microbiome medicine to the home of the individual. So my hope is one day we can build a smart toilet whereby you sit in the comfort of your home, and when you go in and have a little dump, we will be able to monitor your stool, your microbiome in real time using a wearable device, actually. And it can predict your risk of diseases or even tell you, Moses, you haven't had enough vegetables or fruits today. I think you need to increase it. And I think this may one day actually become reality. It's really not mission impossible.
The idea of smart toilet is really innovative, and I wish I could have one at my home. So before we end, can I ask you a final question? What is the key takeaway that you would like our audience to remember from our conversation?
So I think the message number one is 90% of the happiness hormone called serotonin that keeps you smiling is actually made by your gut microbes. So I would say, a happy gut, then a happy mood. The second takeaway message is that 70% of your immune system also lies in your gut. So if you have a healthy gut, you have a healthy immune system and you're always safe and fit. The third message is there are now things to show that how well you age or longevity also relates to your microbiome. So I would say happy gut microbiome, healthy aging.
Wow, that's incredible. So thank you, Professor Ng, for your incredible sharing, and we hope this conversation can inspire our audience to take good care of their guts. We hope you enjoyed this episode, and if you do so, please give us a like, share this video with your friends, and subscribe to our YouTube channel. Stay tuned for our next episode as we'll invite more CHK members to explore other fascinating topics. Thanks for watching, and we'll see you soon. Bye bye.
Bye.